All right, guys. Hey, Dr. Michael Derry here today. I'm a doctor of physical therapy, and I always work with my clients improving their hip and lower back strength, especially for people who have problems doing things for a long period of time, such as walking or just doing things during their day, or if they just want to improve their endurance and strength of that area. So today I want to go over 5 great exercises that have been shown to be effective and efficient for improving hip and lower back strength when you're having a tiny bit of lower back discomfort and stiffness, and you just want to improve the overall resiliency in the area. So I'm going to go over those 5 exercises right now. All you're going to need is a little bit of space and a looped band. And so this looped band is medium to light resistance. And we're going to use this band just to generate a little bit of extra resistance and get a tiny bit more strength out of those muscles and improve that endurance. So what you're going to feel during this is some burn, which is good, but nothing's crazy hard. It is just going to be done for repetitions. And I'll put that in the description so you can reference that in the future. But we're going to go over these 5 exercises right now. Get ready to enjoy that burn. All right, so I have my buddy Roy here. He literally looked at the board and had no idea what the exercises were. So we're going to get going here. We're going to improve his hip and lower back strength to help reduce a tiny bit of discomfort in my most commonly treated condition out there, which is lower back pain. So I'm going to have him for the very first one here, put this band around his knees. He's going to stand here. So I'm going to have him start at his knees for most of these. But to make the exercise harder, you can always shift the weight down towards your ankles. But we're going to go at the knees. And what he's going to do is just do a standard squat here. So we're going to hit 12 to 15 squats. Knees hip are about shoulder width apart. And he's going to go down into the squat and not let that band push his knees in. So that's what he's going to think about resisting. He's going to go down in the squat and kind of resist his knees. Let's go. So Roy has wonderful hip mobility. He can get well into that squat. He looks really, really good. And what I'm looking for is just making sure that those knees don't collapse in. And that band is just giving him a tiny bit of resistance going there. He's about 5 reps in now. Looks good. The squat is such a foundational exercise. I can't get away from it because it works almost every leg muscle in your body as you're going through it. And at the same time, he's getting a tiny bit of contraction in his lower back muscles, which are giving him some good strength and resiliency. So he's moving, grooving here. This 12 to 15 reps has been shown to be a sweet spot between strength and size. And so if you want to improve your strength and endurance of your lower back, 12 to 15 reps is great. Now in the description, I'm going to do a couple sets, but right now we're just going to have him move on to the next one. Sound good?
Yep.
How did that feel?
Good.
Perfect. All right, so he's going to go right into monster walks. And what you're going to see him do is you can come over here with me, and he's going to maintain that resistance. You can stay where I was.
Okay.
He's going to maintain that resistance in the band, but he's going to get down into like a squatted position. And he's going to take about 2 or 3 steps forward and then 2 or 3 steps back in that sport ready position. Here we go. Yeah, so he's got a nice low position here. He is doing well into that squat position. Keep going. You're going to go back and forth. We're going to do this about 5 times into that space. Good. So what he's going to feel here is his quads working. He's going to feel his glutes working. He's getting that good resistance from gravity in his lower back. As you can see, he's leaning forward a little bit and gravity's trying to push him down. So his back muscles have to contract. Now, Roy was gracious enough to join me on a workout yesterday. So he is feeling a little bit stiff and sore. So I'm not going to kill him here. That is perfect. So we did the squats. We're doing just did the monster walks. Yep. Now we're going to go right into the side step, which is exactly the way it sounds. He's going to face here, and he's going to go down a little sport position, just shift the weight into your heels and just step all the way across here and then go all the way back. Good. So this side stepping motion engages those nice glute med muscles, which are wonderful, wonderful hip stabilization muscles that we need to do things for endurance-based activities such as walking. Good, and back. Good. Like I said, you only need a small space to do this. So we're going to go back and forth until we feel that good burn of the hips, which I typically find to be about 30 seconds, 45 seconds, and maybe a minute in some. Sound good?
Good.
All right, here we go. We're going to move into our next one. So he's going to stand nice and tall. He's going to get back here with me. Good. And this time, this one's a little bit of a balance and strength at the same time. He's going to shift his weight to his left foot, a little bit of bend in that left knee, and then kick that right leg out. Good. He's not going to let that leg come in front of him. He's going to let that leg be at his side, if not a little bit back. Two muscles he's going to feel working here. He's going to feel this stabilization leg really firing up into his glute, and then he's going to feel his glute med over here working as well. Now, if Roy didn't have splendid balance, he would be holding on to this bar back here to give him some balance, or a countertop to kind of give him that little extra nudge so he can make sure he gets into the range and feeling it where he needs to feel it. So he should be feeling it in your hips, right?
Definitely.
Other side. Perfect. So it's amazing. He's getting some good quad activation, right hip activation, left hip activation, and all of those muscles attached to our lower back. And so they're good stabilization muscles to give us some lower back endurance and strength. And I love doing this type of stuff because in people who have moderate to severe lower back pain, it's hard to really tackle the back area itself. But if we can work around our back and finally narrow down on it, I found that to be an effective approach to help improve long-lasting or chronic lower back discomfort as well. And I always emphasize that we're working on this stuff to build our resiliency and to build your strength and endurance. It's well earned. And I can tell Roy right now is earning this hip strength. His last one here is that we're going to stand up nice and tall, and we're actually going to face this way. He's going to hold on with his right hand. He's going to stay tall at that back, and he's going to stabilize on his left leg and kick the right leg straight back until he feels the resistance in the band. Perfect. I promise you I've never shown him this exercise, but his form is superb. He's got a nice lumbar extension. He's getting that full hip activation, taking his full hip range of motion, and he's able to go into it. The only thing I would change is that little bit of leaning forward. Go back again. So it will reduce the range of motion, but it still hits that glute. So primary muscle is glute, secondary muscle is hamstring. So we're going to keep kicking that leg back, keeping it straight as possible. Switch sides here. Form is great. And if Roy were a lower back patient of mine, he'd probably be done in a couple of visits because he's killing it. He's doing so good. You feel that in your glutes?
I do.
I love it. Could not love it more. So with this entire workout, we've been able to work all the muscles surrounding the back. We've been able to improve the actual lower deep back muscles called the multifidi and the other surrounding musculature to help give this area some stability. I shouldn't say stability. I give this area some strength and endurance and some overall resiliency. And so what I'll do is that he recommends we go through that entire program for another set, and that'll be good for him. And of course, he could do some mobility exercises, which we went over in past videos. But that little workout right there will give him enough to get some stimulus into the back and hips to generate some change. And that change we're looking for is strength, endurance, and a reduced discomfort. And the overall theme is just building resiliency, because the stronger you are, the stronger your spine will be. So this is well earned. It will take time, but it will work. And if you guys have any comments, please leave them in the description. It's super helpful in creating future content. And as always, guys, if you like the content, please subscribe. But just stay healthy, keep moving, and take care of yourself.
Thanks, Doc.